This presentation is going to explain more about how solution-focused brief therapy is a valuable treatment process for process addictions. First, let's define what solution-focused brief therapy is. And as defined by Winbolt, who wrote Solution-Focused Therapy for the Helping Profession, says it's a short-term goal-focused therapeutic approach which helps clients change by constructing solutions rather than dwelling on problems. Solution-focused brief therapy focuses on three main areas in the client's life. It focuses on the client's abilities and strengths, the present and the future rather than the past, and it also focuses on the client's achievements and successes that have already been made. This is a typical outline of what a session would look like with a therapist using the solution-focused brief therapy. You start with an introduction, which is building rapport. Identify the problem, pre-session change, which is asking the client if they've noticed any difference in the problem since scheduling the appointment and now. The miracle question is a question that's simply asked by saying, if you were to go to sleep tonight and a magic wand was waved over you and you woke the next morning without the problem, what would your life look like? Goal setting is important, then summarizing the message of the whole session, and then asking the client to do a little bit of homework for the next session. During this, you also want to use problem-free talk and identify the client's strengths and resources. And you also want to ask if there's been any exceptions to the problem, so times that the problem's been less noticeable or it hasn't been there at all. Cognitive behavioral therapy and solution-focused brief therapy have a few similarities. William Strong, who is a social worker and therapist in Denver, Colorado, regularly applies solution-focused therapy to adult clients as well as families, couples, and children in need of counseling. Both well-established therapy techniques, solution-focused brief therapy and cognitive behavioral therapy, share certain basic similarities. Broadly speaking, both forms of therapy focus on helping the client identify and cultivate solutions while decreasing the emphasis on negative aspects of the client's life. A few things that I've seen that are similar in the two theories are identifying strengths, correct negative thoughts or behaviors. There's goal setting, and also I feel that the miracle question in solution-focused brief therapy and cognitive behavioral therapy, when you ask the person if this was a friend with the same problem, what would you tell them? I feel like those are really closely related. These are just some process addictions that we've gone over in class that solution-focused therapy would apply to. In every single addiction, you can always use this therapy. There's also 6 stages of change for addictions. The first stage is pre-contemplation. In this stage, the addict may see consequences related to their addictions, but they always find an excuse or they can justify that action. They do not see their addiction as a problem. There's the contemplation stage, that the addict is aware that their addiction is directly affecting their life, and now they're kind of weighing the options if they're ready to give that up or not. The preparation stage is when the addict has made the decision that they want to give up that addiction and that they do have control over their lives. The action stage is when the addict actually gives up that addiction and starts engaging in a more healthier lifestyle. The 5th stage is maintenance, which is kind of building off the action stage. They're still remaining clean, and they also are learning more about their addiction, such as the triggers and stressors that may cause those cravings. There's also the termination or relapse stage. For addicts that have success or are successfully staying clean, it's called the termination stage because they can look themselves in the mirror and know that they're doing better. And then there's also relapse because a lot of time addicts relapse, and as a way to make it feel as less humiliating or they can't achieve it, you just start the stages back over again. When will SFBT work best? Kim says that SFBT has been found to be clinically helpful in treatment programs for adolescents and adult outpatients. When used during the contemplation stage, SFBT therapists will be able to help the client realize for themselves the benefit of quitting. Once in the preparation stage, the addict can make clear goals that will help with motivation for quitting and how to quit.